break, we're going to go into early signs of detection, all that good stuff, how you spot this stuff early on, and the steps you should take to prevent all that, this stuff that you don't have to deal with in your old age, and all that good stuff. So, all right, so we're on a break, so you can tell the YouTube people something that we wouldn't guess. Tell us something we wouldn't guess about you.
Oh.
And if you don't tell me, I'm going to ask him. So
okay, so I actually was I went to Olympic trials for high jump, and I'm only 5'5".
What?
Yeah. So that lineup was like 6'7", 5'5", and jump back up. Yes. That's when I realized, okay, it's bigger than me. It's bigger than me.
Hey, welcome back to this week's edition of the Leadership Blend with your host, Ricardo Rice, and my very special guest, Dr. Nikki Hill. Say hello to the people again.
Hello, hello.
Oh my gosh, she makes me so sick. She has pretty hair. She's back here stroking it and playing with it. You guys have to go to the YouTube channel and see it. Like, she's pretty and she knows it. So she'll fit right in with my family because most of us are too. But it's all good. All right, so when we left, we were talking about lace fronts and wigs and whether you should or shouldn't. So we're going to start from the beginning. So we're going to go into how you early detection, what are you looking for, things of that magnitude. Because today, this is all Dr. Hill. Like, this is not my lane. I'm bald, for those that don't know. I've had curls and texturizers, and I think they burned my hair out, so now I'm bald. But it's okay because it's easier to maintain because I don't have any hair, so it's all good. I'm fine. It's all right. Dr. Hill was a little too late to save me, but she can save you. So we're gonna start from the beginning. So Dr. Hill, tell us about early detection, things of that magnitude.
So early detection. So this whole segment we'll talk about early detection and why it's so important. In regards to the individual who is experiencing hair loss, by the time they get to me as a dermatologist that specializes in hair loss disorders, it's 5, 10, 15 years down the road from when they potentially remember the first symptoms. So it's really important to identify and understand what those initial symptoms are. Like we kind of touched on earlier, your scalp is still skin, so it shouldn't have any symptoms. The occasional itch and scratch here and there, but you shouldn't be digging into your scalp with the end of a rat tail comb or, going to town patting like all day long.
Just gonna throw that out there, huh?
Just gonna throw it out there, because I see it.
What about patting your weave? Is that if you pat your weave, is that
if you're patting your weave,
you pat your weave,
there's probably something going on that we need to either take the weave out or we need to wash that scalp. So, or it's so tight that it's pulling the hair out of the scalp, and that can cause a little bit of itching or sensitivity. So I have my ladies that come back and they're like, yeah, this is a new sew-in. I'm like, did you take an Advil when you went home? They're like, yeah, I have to. That shouldn't be a prerequisite. You shouldn't have to take an Advil or Tylenol when you get your hair done. That's not okay. Because now that means you're pulling on those pain receptors, and those pain receptors are telling you, back up, because this hurts. You pulling the hair out to the point that these pain receptors are getting activated. So when you feel that, or you feel the need to have to go take a pain reliever, that's something not right. Tell the person that's styling your hair, hey, take it down, redo it, lessen the tension, braid it less tight. I don't understand the concept, I want to braid it tight so it lasts longer. It'll last longer, but you won't have no edges, or you won't have any rest.
All right, well, let's dispel rumors then, because let's dispel. We're segueing into rumors, so let's dispel some urban myths about black hair. All right, so the patting of the weave tells us there's probably a problem.
Yes, that's not okay. Either the scalp needs to be washed, or there's a lot of tension on the scalp, or you could be having an allergic reaction to either the if they did any kind of adhesive, or whether the type of the weave that's used. I mean, weave is coming out left and right. I'm like, where are they manufacturing all this weave from?
That's a lot of dead horses. A lot of bald horses running around here.
And women too. But I mean, weave is just like coming. Everybody's selling weave, right? Everyone got a side hustle. Like, I need to sell some weave. But like, everyone got a side hustle.
They gonna want your hair. I'm telling you now. If you go out there, they gonna want your hair. They gonna want you to cut it. I'm telling you.
But the thing is, like, the supply and demand. So what's happening? Because I have patients that come in and say, I always use this particular type of brand of weave. I switched over because this is all they had, and I had intense burning, itching, and irritation in my scalp. So the question is, what's going on with the weave? Are they treating them with chemicals? Is something happening in the packaging? Are they being cleaned appropriately before they're being placed on your scalp? Because outside of anything else, it's an isolated event of I had all these issues when I used this particular brand. I keep hearing it more and more and more, so I'm kind of like, try not to switch away from what you typically use and you've never had problems with that particular brand. The black latex glue, just bypass that. Like, that has black pigment and it has latex in it. It's like the top two things that people are allergic to. Just don't do it. Just say no. And then when it comes to I guess in regards to the myth of that, so you got to make sure that you're monitoring how the scalp feels when you have the weave in. Patting, not good. If you got to pat too much, then you probably need to take it out, wash the scalp, and wash the hair. Everyone's on that relax now, but it just depends on what the ethnicity of the person or the hair curl pattern of the individual that had the virgin hair. Virgin hair on me is going to be curly. Virgin hair on an individual who is like Caucasian background may be wavy or tightly curled or straight. So it also depends on just the ethnicity of the individual and their curl pattern.
All right, let's go to another minute. I know I didn't prepare you for this, but since we segued over there, we're going to say kids and relaxers.
If you can hold off, do hold off. I just recall and going back to when and bless my mom was hard.
All right, well, hold on. We actually have a caller.
Okay.
All right, so caller, you're on the air with Ricardo D. Rice and Dr. Nikki Hill. What is your question or comment?
So the question was, if there's a rash on the skin, is the biopsy the only way to really determine what the diagnosis is? And that actually applies to the scalp as well. So when there's a rash, you go to a dermatologist who studies skin conditions. However, there are over 300 different types of rashes, and depending on what it looks like, where it's located in the pattern, you try to lump it into a particular diagnosis. And there are certain patterns and rashes that look very typical for certain conditions. But sometimes, if it's something that they really need to rule out, like say, for instance, it's a type of skin cancer, and yes, African Americans and other minorities can develop skin cancer, myth. So that's real, okay? But people are not spared from skin cancer. So sometimes they do biopsies to rule out. Sometimes they do biopsies to really make sure they have the accurate diagnosis, because especially if it changes their treatment, then you really want to make sure that you're on the right path. So say if they're kind of saying it's maybe rash, diagnosis A or diagnosis B. Diagnosis A, we can get away with creams, but diagnosis B, we are going to have to put you on by mouth treatment, and we're going to have to monitor blood work and blood pressure. Well, that's a big deal. So instead of really having to make sure, that you're on the appropriate treatment and we are not putting you at risk for other side effects of being on a medicine, sometimes the best route is to do a biopsy. And one thing that I guess the caveat about dermatology is, I hear right now you're kind of explaining what the rash looks like and the pattern that it moves around in. The one thing about dermatology is we actually have to see and touch the rash. Unfortunately, hearing about the rash is not the best way to really understand what's going on. We need to hear the story. We need to understand the background. So without actually seeing it and being able to touch anything, my best advice is to really kind of find a dermatologist that's in your area for them to look at the rash and be able to best give you medical advice once they've assessed everything, including your medical background. The concept of dry shampoos. So dry shampoos are kind of like talcum powders or other type of powders that can really absorb oil and moisture out the hair. It's a go-to, like, okay, I'm not going to be able to get to my hair today, but I need to prolong the process and dry up the oils on my scalp and on my hair for maybe another day or two. It's not an alternative to shampoo and conditioning. So it's okay to use at a one-time in-between wash cycles if you're delayed a day or two, but you don't want to rely on that because you do need to remove the oils in its entirety and the debris and dust and just overgrowth of natural yeast from the scalp using shampoo and conditioner. I got another rumor for you.
All right.
That goes back from way back. Greasing that scalp. Hey. All right, greasing that scalp.
So no Crisco. Are you about to tell me I can't use Crisco?
They don't. Everyone's advanced now. They do the coconut oils. They do the olive oils.
Is that stuff good?
I mean, in moderation on the skin is fine.